Hi.
Good morning.
Good morning. Yeah, we've got to get some energy moving. It's early. It was a 2-hour drive. It's crazy. So, anyway, I'm glad you came, and I want to make my talk, it's going to be sort of an empowering talk. I used to go to a lot of Lyme conferences, and I would be the guy who talked about self-empowerment, herbal medicine, but very often it was in conjunction with, Lyme literate physicians. And the Lyme literate physicians really were great. They're doing research that's from their heart, but it's a very convoluted, complex issue, as I think everyone here knows. And it's very hard to target the bug, because Lyme doesn't come in by itself. It comes in with friends, what we call co-infections. And very often the antibiotics are tied to target a particular bug, and then if you have anaplasmosis or Bartonella or blah, 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 there's other drugs that we can have. But, one of the research findings recently is that people who have taken multiple antibiotics for chronic Lyme tend not to do better than the average population, as far as most of the studies. And I used to walk away from these conventions depressed, because everyone was trying to find something that would work, and everyone was feeling really down, and the doctors would say, well, we're trying to add this drug, and you do this drug, and now we're open to herbs. So we use cemento and banderol. I don't know if any of you. It's part of the Caldon, it's part of, I really respect the natural approaches, and we'll talk more about that. But as I investigated some of these herbs, then, 6 drops of an herb is not going to create a Herx reaction. So there's something empowered about, even though we call them herbs, I think they're kind of more acting pharmaceutically. But my practice was more and more Lyme for the last over 20 years. So I'd say maybe 40% of my practice is Lyme, not something I chose. I used to work mostly with gynecological issues and autoimmune issues, and I'll tell you a little about me. But I started realizing when people came to me, it's when they were usually frustrated with Western medical practice. Sometimes the blood tests would not show anything, and the doctors would say, you don't have Lyme. It's not Lyme. You're inventing these symptoms. But very often those symptoms persisted. They went to other places, and the Lyme can hide. It's a collagen-loving microbe. So when we take the blood, it's often not in the blood. It's hanging out in the collagen of the eye, in the knee, in the tissue itself. So we have to be lucky that the Lyme is migrating when you take the blood and say, you've got Lyme, we can treat it. But there was something someone had mentioned about one of the side effects of Lyme, whether it's Lyme that creates it, and I believe it's a smart microbe, is depression and a feeling of hopelessness. The first thing we notice with Lyme very often, with the aches, with the sometimes fevers, and the symptoms are so myriad, is brain fog. Almost everyone with Lyme say their cognitive functions are impaired. And I think that's part of the germ. So there is this depressive energy that goes with it. The way I met Jasmine, I'm going to be meandering a little, and I hope it's okay. At the end of the talk, I'm going to get plenty of time for specific questions. You'll learn more about what I do and what I use, which will give you more ammunition to kind of target me and ask whatever questions you might have. But Jasmine met me through a mutual friend, Jasmine's acupuncturist, Dr. Leon Hammer, who's now in his 90s. And Dr. Hammer was my mentor for pulse taking. He used to be in Saratoga Springs. I would drive up every Tuesday for 2 years and study with him, seeing patients, taking the pulses. This is a Chinese diagnostic procedure that can really tell a lot about a person. And over 2 years, we developed a very deep friendship. He became my mentor, my father figure, and my friend. And we just through writing the most recent book I wrote, which is about the healing journey, traveling around the world to different cultures, studying healing across the globe, in India, the Philippines, China, and other places, and kind of coming to a commonality of what healing is. And I'll move there too. But Leon's teacher was a Dr. Shen, who came to my acupuncture school one day and was talking and did a talk which really, one metaphor stayed with me. And he was talking about antibiotic use. And he said, oh, antibiotic, good. I'm going to put on a Chinese accent. I'm not bigoted, please. But it was in Chinese, very good. Like machine gun. Burglar come in house. Antibiotic, like machine gun, go boom, boom, boom. Kill burglar. Burglar fall down. Shut door, burglar, rotten house. You know, and I thought about it. It's like you can kill germs, but there's a residue. And you need to find a way to help the body cleanse itself. I'm going to move from that to kind of where this talk is going, which was, I think last year I did this talk too. It's not going to be that much different than today's because our empowerment and the herbs that are used for Lyme have not changed much. The drugs change constantly. But I don't know if you know about this dialogue between Pasteur and Bernard in France. They were around the same time. Pasteur was developing what we know as germ theory. You know, germs cause disease. If we find ways, pasteurization, using his name, but you know, multiple ways of dealing with germs to get rid of them will cure disease. And the other guy said, no, germs don't cause disease. They're a cofactor. They're a variable. He said, le terrain. It's the body that either receives the germ or repels it. You need to nurture the terrain and make it less hospitable to disease. And they would, you know, those are the two main hospitals in Paris today. But apparently, and this is true, you can look it up on Pasteur's deathbed, he said Bernard was right. The germ is nothing. The terrain is everything. So I'll paraphrase, the germ is something. Lyme is something. But what we're losing today in this medical world that are treating Lyme with multiple drugs is we're losing the person. People come to me again and again with chronic Lyme, and a lot of my practice is that. It's built a reputation for that. Sadly, but I love being able to support people. And not everyone responds to this either, but many people do, and I take them off of all sorts of stuff because they see Lyme as a battlefield. That the more ammunition we can muster up, the more antibiotics, the more herbs, the more, and I'm putting herbs in that category too because, you know, we think of herbs as benign, but they're not. Most of them, the ones that I use, are mostly what we'll call benign, and I'll talk about more of that later. But, you know, you get a lot of the pharmaceutical medicines extracted from herbs. That's how we found them. I mean, actually, now that I have permission to meander, I'll tell you a little story about herbal medicine. Back, his name was Dr. Witherell. This is back in the 1700s. Was treating a disease that we know of today as congestive heart failure, which killed people routinely. And back then it was called dropsy because you couldn't pump the blood and it started coagulating because the heart wasn't able to pump it in the feet, and it would move up until they suffocated in the lung. The water would move up. And there was nothing they could do for that. But there was one wise woman herbalist in this country cabin who was treating it successfully. And he said, I've sent people to her, they come, they get over dropsy. So they try to figure out what it was that she was doing, because she was doing something. And she would make an herbal combination, but the main herb was foxglove, which we have to use very carefully. And it was with other herbs, balance the person, and people would get over it. So of course he took the foxglove he dissected it and tried different ingredients and found that one of the ingredients within the plant was digoxin, today called digitalis. You know, so this in England is used by the herbalists. I'm a certified herbalist in England. I'm a registered Chinese herbalist, but we don't have a nomenclature, and a lot of people do herbs, you know, that it's generally safe, but you get herbs like foxglove, which is illegal in this country, because it is toxic if not used rightly. But in England, the herbalists treat congestive heart failure with the herbs. And what they found just 10 years ago in a study was that when people were treated in England, because it's legal, with the foxglove and other herbs, it supported the symptoms, but they had many less side effects because a lot of the ingredients in foxglove countered some of the natural side effects that digitalis creates. So, you know, it's another way of really addressing disease. So, I mean, that to me is herb versus medicine. Herb nurtures the body so that it can heal itself. Medicine tries to do the healing, and it really sometimes has a lot of consequence and what we could call collateral damage. Although it's really, you know, targeting the germ, it kills a lot of other good cells. So the Chinese approach is different than the Western approach. The Western approach is get the artillery and let's hammer the invader. And if we don't know which invader it is, get extra artillery and just buckshot. You know, get it everywhere. Make sure to kill it. And, you know, people walk into my office and that's the road that they were on to deal with Lyme. And not only are they taking all these antibiotics and what we call cyst busters to break up the envelopes that the Lyme kind of hide in, they build these cysts around themselves. But, you know, they're run down. And the herbs are herbs that have that kind of ammunition type of quality. And the first thing I said, how can your body handle all this? You know, you're losing the garden. And the garden is the terrain that you know, we were talking about before. We need to rebuild the body. It really does very well at creating a homeostatic mechanism of healing itself. But we need to feed it. We can't assume that if we keep feeding it poison, it's going to come back and it's going to find a place where it can deal with the pathogen. So in Chinese medicine, they kind of divide immunity into the battlefield and the garden. The battlefield, Western medicine is very good at, and I will go to it. If I have a germ that has a bullet destined for that germ, I will take it. I will do what I can, you know, to counter the negative effects of it. But broad artillery, I really try to avoid, especially when I know it's depleting my immune system. So there are times in Chinese medicine, a lot of the herbs, the main herb today for Lyme was used in Chinese medicine for 4,000 or more years, and it's in the wormwood family. And wormwood is wormwood. It killed worms. But they found that Artemisia annua, which is sweet wormwood, it's, you know, they have it in China, in studies have been shown to really target Lyme. So it's in a lot of the Lyme, you know, but it's balanced, it's broad spectrum. And the difference between the herb and the antibiotic, even though wormwood targets the pathogen, is that it's complex. You know, the drugs are simple. We try to refine them so they have as limited a range as possible, which is good anyway if you have a limited bug that you're targeting. But what happens is Lyme is smart. We've learned that to our chagrin. It really is a smart microbe. It can transmute, and it builds tolerance like every other bacteria does. So if you keep using the same drug, which is linear, to battle the Lyme is going to transmute and become immune to that particular. It'll find ways to barricade. What I love about the herbs are they're much more broad spectrum. Within wormwood, just as within garlic, there's hundreds of different sulfur compounds that are all antimicrobial. So if a microbe develops an immunity to some aspect of garlic, there's other aspects. It can't develop an immunity to the herb. It's too complex. So that's another reason I prefer using herbs to treat Lyme when I can. So the Chinese really focus more on the battlefield, on the garden. The battlefield we need, it's like if you have a garden and it's infested with a disease, by feeding the soil, it can often help, but sometimes you need a pesticide. But we need to make the soil healthier. And their concept of health is prevention, is creating a healthy soil, is going to the garden and seeing what we can do to make it healthier, where it's more resistant to invasion, by fungus, by whatever the pest might be. And the way we make a healthy garden are threefold. So this is Chinese physiology. There are three ways that we make the energy that's protecting us. What they call Wei Qi is the immune energy of the body, and it's made from three sources. You've got the air we breathe. It's called Da Qi. So Qi is energy. Da means air, energy from the air. So from the air, if we breathe, and sometimes we need to be conscious of breathing, that when we have Lyme or when we're depressed, we don't breathe, we hold it. So if we can be conscious to breathe, hopefully healthy air, we're in the country here, we imbibe something in the breath. We can call it prana, qi. It's in the breath. Actually, if you think about it, the word that's used for breathing in is called inspiration. We're inspired. We bring spirit in with the air. That's what the Chinese call qi. So we bring qi in through the air. That gets processed by the lung and is sent to the kidney. Now, don't believe any of this. It's metaphor. It's Chinese. The other avenue of bringing energy into the body to create a healthy immunity is food. Guqi. And it's energy derived from food. So if we eat healthy foods, if we eat foods that are non-tainted, if we eat foods that are from the earth, that will help us again to build a healthier immune system. Now, I think we all know this. So you want to stay away from refined carbs, and this will be talked about a lot later. And the third area of deriving energy is what's called Shen Qi. Shen means spirit. So it's spirit in a different word than inspiration, but it's spirit in the sense of love. It's spirit in the sense of relationships. That through the heart, we bring spirit into the body, and those three energies. So we want to surround ourselves with more positive relationships. I ask people when they come to me, if Lyme could talk, what would it be saying? In other words, instead of making it the enemy, which it is, but we have a choice when we're dealing with enemies. Can we learn through this encounter with the enemy, or we are victimized by this encounter with the enemy? So what might be saying, and many of them would say, my relationships are really toxic, or my friends. I say, you really have to meditate on that. You don't have to be nasty, but when people suck energy from you, avoid contact. Unless you can confront it in a loving way and say, we need to talk about this. But don't be around energy that's negative, because it affects you, and it affects your immune system. So these three energies, the Da Qi from the lung, the Gu Qi from the spleen, the pancreas, the digestion, and the Shen Qi from the heart, they say, merge and go to the kidney, where they're synthesized together, and they form two energies, the Wei Qi, the immune energy, and what they call the Qing Qi. I'm not going to test you on any of this, but it makes sense in some way. It's out there. Qing Qi is the energy that literally feeds the organs. It's the vital energy that moves through the energy channels, and I'm happy to ask any specific question later. So the Qing Qi will help our organs function better, and the Wei Qi will help our immune system. That's what we call the white blood cells, or function. So that is creating a really, really healthy garden. And then we can see where we need to enter the battlefield, where we need to enter and use drugs, because when used rightly, they're good. They're really helpful. And probably some of you have been suffering from Lyme for years, and it really gets to my heart. I've had it 3 times. The first time I treated it with antibiotic, and it was effective. But when it gets deeper, it's more difficult. So the other 2 times I've had it, I've treated it with herbs. I've had a few women who worked with a doctor in Connecticut, actually. He's in New York City now. I'm not going to mention names, because he wouldn't work with me. But anyway, he was giving them intravenous antibiotic and other antibiotics, and they were just so drugged out. And they had been going for a few years, and their body developed allergies to the antibiotics. So they couldn't take them. And, he didn't have much to offer, and they heard about me, and I made them an herbal tonic. And we worked for a while, and we worked with what's going on psychically, how do you feel powerless, what can we do to create a more positive vision. But the herbs, the acupuncture, and 3 of them, this group that came, all got better and went to this doctor and said, this guy is using herbs. Would you consider, because I asked them to ask him, working in conjunction when the antibiotics don't work, to work in conjunction. And he said, if you work with him, go to him. And that to me is the sad part. It's like, I'm not against Western medicine. I want to be complementary. So I hate the word alternative medicine, because it's either us or them. It's that old. Complementary medicine is using the best from what Western science has to offer, and there's a lot, and working from a more Eastern, feminine point of view to promote care rather than cure. Hopefully enough care creates cure. But if you focus only on the cure, there was a very cute story. There was this doctor who was walking down the street, and he sees this guy floating down the river. And he jumps in, he pulls him out, the guy's barely breathing, starts giving him mouth-to-mouth resuscitation, and all of a sudden 2 more bodies come down. And he pulls him out of the body, mouth-to-mouth resuscitation, 4 bodies come down. And he's so exhausted treating these people, he has no time to go downstream and see what's causing them to be sick. If you can get to the root, medicine is very good at heroics. It really, if I'm dying, if I'm having a heart attack, if I have a broken leg, I'm there. But with anything chronic, I feel they're stuck. And what's nice now is, because of people like you, like me, people are demanding complementary services. So Sloan Kettering, most hospitals now offer complementary medicine. But they're starting to believe in it. Not so much they began doing that because they believed it was effective, but why put the money out there? We can keep it here. We'll import people into the hospital setting if they want it. But part of complementary medicine is belief. And belief, if I could bottle that, I'd be a very rich man. The way that Dr. Oz got famous, I don't know if anyone knows this, one of my clients was this woman, Judy Motz. Judy Motz was an energy healer. And for some reason, they wanted to do experiments at, I think it's Columbia Presbyterian that he worked at. And he was the chief, thoracic coronary surgeon there. He agreed to have an energy healer come into the operating theater. And while he was doing surgery, in this picture, she wrote a book about it called Hands of Clay. She's wearing surgical gear, and while he's operating, she's promoting prayer, energy healing toward the person. And half of the patients got this, it doesn't interfere with the surgery, and the other half didn't. They had a person standing wearing garb to make, sort of control that variable in the experiment. But what they found was that the group that was healed or preyed upon had less nausea, got out of the hospital quicker, had less complications afterward. So, she came out with the book. Dr. Oz wrote a book. And of course, that's just the thing that gets Oprah. Oprah had him on her show because of that. And now he's America's doctor.
Yeah.
But he was open to that. That's how he really got his start as, complementary or holistic. So it's really, I think our consciousness is so important. And this is what, when I traveled around the world, my new book is about this journey, but so much of it is about belief and the use of energy. Because all healing is energy. Energy flows through our body, energy heals, and an insidious part of Lyme is, I really do feel, part of the microbe is that it creates a kind of depressed or, it affects our consciousness. It affects us energetically, not just physically. And when we feel that, it's smart. If we can feel depressed or hopeless, we're less able to defend ourselves.
Mm-hmm.
There was a study at the University of Florida, and this graduate student was doing a study on cholesterol and heart disease, plaque formation, and they used rabbits. And they had different groups of rabbits, and some groups got this diet, and the other groups got very high diet, very high fat or negative fats. And they found in almost all of the groups, the rabbits that got the really high saturated fat diet developed more atherosclerosis. But there was one group that actually reversed atherosclerosis. And I said, there's something wrong here. And they found the experimenter, and they said, are you feeding it that diet? And she said, yes, absolutely. So they said, let's do the experiment again. They did it again, got exactly the same results. So they said, well, we can't say, I guess, high-fat diets cause cholesterol. Now, this is before some research has been shown to affect it differently. But they said, what are you doing besides the diet? She said, oh, I love rabbits. I stroke them. They made that an active variable in an experiment and found that the stroke rabbits had much less high cholesterol with the diets than the groups that were in stroke. And what does that say? I mean, it says love heals in some way. There's this connection. We create hormones in the body just from creating, we know that oxytocin is elevated when people have dogs and stroke them. It's one of the best preventative measures against coronary artery disease is have a dog, more than the drugs. So what I'm saying is there are things that we can do to prevent disease. There are things that we can do to fight the microbe. But I really feel the core is to create a garden that's healthy and resistant to disease. And then choose when to implement heavy artillery. So it's a very simple metaphor, but the power, a lot of it resides within ourselves. That we can use our own thoughts, we can use our own healing energies. I think we're all healers. When we're in tune with ourselves, with our environment, we're channeling energy and we're light. When we're not in tune with it, we become heavy, denser, and stuff can stay. So we want to get the light moving. Acupuncture really is purely about energy. I mean, I can define acupuncture as where there's flow, there's health, where there's not, there's not. In other words, disease often is spelled dis-ease. It's an interruption of flow. And there are many ways to reconnect to flow. And that helps the healing. I'm not going to be, saying that does it, and, but it really, really helps. So acupuncture is based on finding out where in the body that flow is blocked. So the good acupuncturist, like Dr. Hammer, could take your pulse and he can tell you exactly where we need to direct the energy to break through a blockage in the channel that feeds the organs. So that helps. I love it. It's part of what resonates with me, but it's not the only healing modality that works. Far from it. And I guess if I leave you with one really important gift, is to trust yourself. That healing, when I went around the world and I worked with psychic surgeons in the Philippines and Ayurveda in India and Chinese medicine in China and, key energy in Japan and with Native Americans here, Rolling Thunder I worked with, they're all saying the same thing through different mediums, and I don't think it was one necessarily more effective than the other. I don't have the answer. Acupuncture isn't it for everyone. But if you vibe with it, I have people that say, this feels so right. I said, then I have a really good feeling this will be effective. But what we need to do, and this has been stripped from us, is to really trust our intuition. On a deep level, we know if something is healing or if something is negative. Same with doctors. If you walk into a doctor and you feel he gets you in some way, I mean, you have to trust the science. But don't go to a doctor that makes you feel depleted and down. When you walk out of a doctor's office, if you feel like this, I'm sure there's another doctor that might use the same pharmaceutical protocol, but that you feel energized with. Trust that. Our societies try to strip us of our inner knowing. And I think that's an important part of the healing. And that's why I said I'm not going to give you anything new. There's a lot of studies, but I feel that we know the basics about treating microbes. Lyme is a much more elegantly conceived microbe. It has a lot more tricks to hide, so we need to bring more forces to bear. But truth is old. I started my book with a quote which says, by Hugh Kerr, that says, all wisdom is plagiarism. Only stupidity is original. There's nothing we can say that hasn't been said before that taps into truth. And, I use the old school method. I'm totally open. For years, I studied every scientific paper that came. I want to know what's going on, how things are being treated, but I don't see it in my practice. I don't see people that are taking the new and more high-potent drugs getting better quicker. Now, that's anecdotal, but I haven't seen studies that prove that either. But I think it makes people feel better that they're attacking this, so they'll come in with shopping bags full of herbs and drugs and whatever that's targeting the Lyme. And target, but nurture. So that's my advice. But I'd like to open this up as an herbalist, as an acupuncturist. You may have questions. I'd love to respond. I know that's good. So thank you. Yes.
You mentioned that the Lyme pathogen hides out in collagen. Now, it seems to me that there should be some kind of biopsy type test, that some kind of needle aspiration from collagen that would verify that.
I agree, and I bet they could do that. I mean, I don't know that it's done. I mean, it makes perfect sense.
Well,
I mean, because it's where the symptoms are. Some people get visual symptoms. I'm sure you could, with the knee. It's where it's flaring often that the Lyme, and because of their corkscrew shape, they do get it. It's a great question. I really don't know. It makes sense to me.
Now, I think of collagen as skin. I mean, what is collagen?
It's connective tissue. So there's collagen matrix in the aqueous formations around the eye, around all the joints of the body, and in the skin. We talk about collagen treatments of the skin, but
so it's different than collagen is just not one thing. It is in general, but it's probably texture or physics can be different if it's near the eye or near the knee and so on and so forth.
Exactly, yeah. It's a matrix that forms our connective tissue. And so it's hard. Hi.
Hi. I think you already just answered it because you said trust yourself, but you were talking about acupuncture, I got here late, unfortunately, but when I tried it, it made every one of my symptoms so much worse. And the guy, he never wanted to see me again. He's like, I'm so sorry, I don't know what I did. And so it was kind of scary.
Yeah.
And so I guess everyone's different.
No, that's,
I don't
that
know.
it,
I just picked them out of the yellow pages, I don't know.
yeah, I mean, you know, it's trust your healer, but that may have
Is
been the
that
healing.
bad, or is that?
No,
could
it's
that
not.
have been good?
It
Because
may-
some people say it could have been good. I'm like,
It could have been
what?
good, it could have been bad. I'm sorry, I'm not kidding. But, you know, we all know about Herxing,
Right.
right? So sometimes when you get the, and I always warn my clients when they come, that initially, if we get the energy moving, it will do battle with the pathogen. And sometimes when the battle happens, now the Chinese say that the Wei Qi, the immune energy, is carried along meridians.
Yeah.
And I can explain a little about that. I got to fill my time. But each major meridian that goes to an organ has a superficial channel that carries the immune energy,
Okay.
which is why the Chinese say when we're aching all over, we're healing ourselves. That's the Wei Qi coming from the resources, coming up to the periphery to protect the inner organs. So the aching is actually the body fighting. It's actually good. Not for a long period of time.
Yeah.
You know, so, and again, we have to kind of judge. And I feel sometimes I would go within myself and say, does this feel like a good pain, like a Herx? Or do I feel this is depleting me and aggravating the symptoms? And I think on some level, yes, you're right. Go back to yourself and ask yourself, but if the energy didn't feel good with that acupuncturist, and if you feel open to acupuncture, again, I'm not saying that's the only,
Yeah.
but it's quite good. You know, find someone that feels good. You can, there's a lot of people out of school that know very little.
Yeah.
I mean, like with anything, you know, you need some, for me, it's an excuse to tap into the person so that together we form a partnership, and that partnership can up the ante energetically and help to beat it. I in no way feel like I'm a healer after years of trying to be one. I feel I'm a partner in the healing journey. You know, at the end of the book, I come to, so what is healing? And I came to the sentence that, you know, healing is to be present in the presence of another in a state of love, and pardon that word, I'll explain it, it doesn't mean I'm in love with you, but in a state of love with mutual intention for the greater good. And it just like resonated. It says, healing is, it's a partnership. If you're working with a healer, and I hate the word, but I use it, you're working with someone who can get out of themselves. They can support you tapping into an energy that in and of itself helps the healer. Remember this guy, Benjamin Rush, said years ago when they were using arsenic for healing things, you know, he said two things. One is, if you took all the medicines in the world and threw them in the ocean, it would be all the better for humankind and all the worse for the fish. But he also said that the art of the great physician is to amuse the patient while nature cures him. You know, it's like, we can heal ourselves. We can use help. But trust yourself. Really trust your intuition. Yeah.
Are you familiar at all with biomagnetic therapy?
Mm-hmm.
And do you find that, because right now I've gone to an acupuncturist. She's a chiropractor, but she practices Eastern medicine, and she also now has been recently certified in biomagnetic therapy. And she says it's been shown to be very effective with those of us with chronic Lyme.
Mm-hmm.
So I just wanted to hear what your thoughts.
I like it, and I like the concept. However, you know, there's rife, you know, and you'll hear more about that, and that's, you know, it really is about upping the resonance in the cells so that they can throw off passion. Yeah, and I agree. The higher the resonance of our being, this is the garden of the energy, as you're operating more fully, the cells vibrate at a higher frequency. pathogens work on low energy, and they kind of escape if the energy is too high. The bioresonance addresses that. And I've seen it work really good for some people and not that good for others, because, again, it has to work with the individual. So I don't have a prescription. And the same with the Rife. I've seen many people do months or years of Rife and not get better, and other people do a month and really. So I love the concept, and I think if you're doing it and you're feeling it's right, give it a chance. I mean, I do like the concept of it.
I work maintaining trails on a regular basis, so I'm in the woods, and about 10 or 15 years ago I was asked to go with a group to Yale to receive injections of something that was supposed to prevent Lyme disease. And I received those injections regularly for probably 5 to 6 years.
Really?
And then when it was done, they called us all together and they said, we have learned that this, what we're giving you is 70 to 80% effective in preventing Lyme disease. There was a test group and there was a neutral group. So it was done. I never felt, I was in the group that got the stuff though, got the real stuff. And I never felt any different before or after. But after about 2 years after the test was over, I called the doctor back and I said, hey, I'm glad this stuff works pretty good. How about I get a booster or something like that? He said, I can't give it to you. I said, what do you mean you can't give it to me? He says, the drug companies won't make it. They can't make any money on it.
It's natural.
End of story. That was the end. Did you know anything about this test?
I knew they were testing one that was a 3 injection, not one that you got regularly.
Oh, it was a long period of time.
Yeah, no, I don't know about that one. I know about the one out of Westchester Medical Center, and then a number of other satellites were experimenting with the 3 injection prevention for Lyme. And they, in studies they found it wasn't that effective, but it skewed. People would always test positive for the titers, so they couldn't tell if the person had Lyme, or so they stopped doing those tests. Now this one, if it was 70 or 80% effective, I don't know, but you might tell from my talk I have no great love of the pharmaceutical companies. I mean, what I love about England and single-payer systems are they use herbs, they use what works, and they keep the costs down because it saves them money, because the state has to pay. We give the pharmaceutical companies carte blanche. I mean, that was, and for people to go to a doctor, I'm having eye surgery in a week for something called a macular hole, and the eye drops are like $150, $200, and you have no control. And that's copay, as a Medicare recipient. So, yeah, I mean, I don't know about that drug, but
I did notice almost right after this was over, I have pets, have dogs, that the vet started giving my dog a vaccine. I think it was called Lymerix or something like that.
Right, I remember that.
So I said to this doctor, hey, you give it to my dog, you won't give it to me. But he never had any good answers for that.
Right. The FDA has to certify, and the companies. I really don't know about that drug. I mean, of course, people who work out there in the open, where Lymes love to hang out, if there were a vaccine, I would be supportive of it. Just if it really worked. But I don't know about that.
What about garlic? Excuse me.
That's right.
What about garlic? Because I had heard when you consume garlic or enough of it, and I hiked quite a bit, and I would take capsules, and it seemed to do a lot for me. I mean, just energize me, and I felt better. And I don't know if that works or not, whether that in fact, the capsule.
There are multiple studies of the effects of garlic. Hundreds of sulfur compounds and other compounds that have natural antimicrobial and I mean, it's great medicine. I mean, is anything definitely going to prevent it. I have a lot of my clients, I have this formula back there called Lyme Out, which after 20 years of making and concocting, which I love to do, formulas, I decided that to treat Lyme we need three approaches. One is the antimicrobial, so we have things like olive leaf, and I have 2 types of wormwood. I have, the onwood that we spoke about. I have Absinthe, Artemisia, 2 Artemisias. And then I have herbs like astragalus, things for the immune system that will support the immune system, and a couple of herbs that support the liver and the lymph. So we don't have those dead burglars hanging out in the house. We help the system to get rid of the debris. So a lot of my clients will take that preventatively.
That. Yeah, I do. I've been taking it. But I started when I saw you at the last seminar.
Last convention, yeah.
And I've run out, so I sent you an email.
Oh, that was
I'm
you.
looking
After
at.
Jasmine said, bring an extra bottle.
Yeah, exactly. So that was me. How long do you take that? I mean, can you take it forever and ever, or do you?
You can, because it's not, but I don't, it's like I'll take it when I'm very vulnerable. If I'm in the woods a lot, I will take it preventatively. Not take a dropper full a day. Also, if you find a tick, I do rub a little into the bite.
Oh, that's interesting.
And that came to me from my clients. They found it was helpful. Yes.
Oh, I was wondering if you know anything about guinea hens, because I hear that they eat deer ticks, and I'm thinking of getting guinea hens, but...
I read the same thing, and I have a friend who has them, and they love it. We can't do, I'm in Westchester, so we can't have them there too. Yeah, but I heard the same thing, and I read a little article saying that they do, they like ticks. So, yeah, I mean...
Chickens too.
And chickens too.
Yeah.
Yeah, I
Yeah.
know the
Chicken you
chickens,
get an
but...
egg from.
Yeah.
There you go, that's true. Okay, chicken's
Are they
good.
huge? Are they big?
They're not big.
Any combination of the herbs for topical use as a preventive that you recommend?
Well, my
same
clients
thing?
have talked to the Lyme Out, and it is this in alcohol, and there are some antimicrobials in it, so if it works internally, to some degree, it'll work, it depends how far in it is. I still feel, to be medically checked.
I meant as a repellent, I'm sorry, for repellent to the
For
ticks. Yeah.
repellents.
Yes, as a topical to
Yeah, I mean,
avoid tick bites.
Yeah, I wish I could say, DEET seems to be, it's toxic, but it seems to be the one that
best.
you can count on.
Okay.
And from the natural ones, if you have something you work with.
Well, actually, I had heard that catnip essential oil is supposed to be good for that. But I don't know. It seems when I spray it on myself, and I use a mixture of different essential oils, and they were just taken from an herb magazine, and they're used against moths. So it's a combination of pine essential oil, there's citronella, there's lemon, there's basil. They don't even mention catnip. I just included that to the mix. Catnip essential oil is supposed to be even more effective than DEET, they say. It's extremely expensive, and I think there are different varieties of it. I go to Amanda, I think Apothecary, to get my herbs. But there's myrrh, there's pomarosa, there's rose geranium, so there are 9+
studies on that too.
Rose geranium.
Yeah, that's my preference. That's what I do. I have a combination someone makes for me of those essential oils. But we don't have, obviously it's very hard to get studies done on herbs because no one makes money. So.
Right, absolutely. Thank you.
Yes. Either one of you.
Oh, just a quick question.
Yeah.
I assume your book is available through all sources?
Yeah, we have it here. It's on Kindle, Amazon.
What's the title of it exactly?
The new one is called Kissing Joy as It Flies. Actually, I'd love to have, it's from a statement, one of the quatrains, I'm not blocking his name. Got it. But it goes, he who binds to himself a joy, does the winged life destroy. but he who kisses joy as it flies lives in eternity's sunrise. And I think these, just lighten me up. So, capture the moment. But kissing joy as it flies is the one I recommend. That's my baby. No, thanks. Yes, Jasmine.
I just want to say, don't get guinea hens. We have done.
Personal.
Guinea hens never shut up.
Yeah.
And they are so stupid. I remember one day I think this happens often, but there was one day I was particularly late, and the damn guinea hens jumped in front of the car. I got out, chased them out. They went back in front of the car. And we went through this a couple of times, and finally I said, get any of it.
Yeah, but they're the ideal fighter for Lyme disease, right?
Yeah, but you won't get any sleep.
Plus, they like chasing lawnmowers. I used to go, my neighbor had 5 of them, and every time I would get on my lawnmower, I'd have 5 guinea hens all over the lawn.
Yes.
Getting back to the immunization the gentleman had in the back here. Limericks was a vaccine to prevent Lyme disease. Limericks, it was called. It was taken off the market, and it wasn't taken off the market because it wasn't profitable. It was taken off the market because it was giving people arthritis and other autoimmune type symptoms. I'm part of that group. I was in the study. Unfortunately, I got the vaccine back in 1999, and it didn't take long for arthritic symptoms to set in. In my case, I met another gentleman one day who was 72 years old, fit as a fiddle. He had gotten the vaccine, and he thinks it's just great. But the reason that vaccine is not on the market is not because it's not profitable. The CDC says there's 300,000 new cases of Lyme disease, so that sounds like profit. There's probably more, like 1 million,
Yeah,
in my opinion.
it's totally understood.
But, I think this gentleman has felt well since he's gotten that vaccine. He's a lucky person. There's no vaccines. There's no human vaccines right now for Lyme disease, and Limericks was junk. There was a class action lawsuit. They didn't call me, you have to call them. So, I could have got my $500, but,
No, thank you. Thanks for sharing that. Obviously, I'm much more into natural medicine. If there were a vaccine that were created that could, I think it's such a sleuth germ that even the vaccine, even if it worked a little initially, I can't imagine. So, thanks. I think we really need to
most
focus
people probably
again.
know that.
No, and that's really useful. Thanks for sharing. Yes.
What products would you recommend for detoxification as well as enzymes?
The enzymes I use, I have an enzyme formula, which is similar to what a lot of people use, which is a combination of nattokinase and mostly something called surreptase. So surreptase is from the earthworm, nattokinase is from soy, and it helps to break up the biofilms that the Lyme. So when the Lyme go into the cell, they exude this proteinous cell that kind of goes, quality that builds up around the cells. It's like what we have plaque in the mouth, or the bacteria in the mouth creating biofilms to protect them. So we have the plaque work down. It seems that the surreptase and the nattokinase work good. I have something called Clarizyme, that we have made for us, but you can get them in a lot of places. The key with the enzymes is to take them at least an hour outside of eating, because we don't want those. They're called protein. They're proteins. They're protein enzymes. They digest protein, so we want them to digest the protein for the cyst rather than help our digestion for food. So we can't take them with food. So I take mine at bedtime. I know I haven't eaten for a few hours, and I won't. What was the first question? I'm sorry.
Detoxification.
Yeah, what's usually talked about is chlorella, which I do like. But, yeah, and I do support. I do support like doing things that are lymph supportive, like red clover. There's a lot of herbal combinations, cleavers. There's a number of herbs, and liver support, because the liver is one of the main avenues of detoxification. So, the prime examples are dandelion root and milk thistle. So this is available all over. We have just a couple of minutes left. 1 or 2 more questions.
What have you found that could be effective for babesia?
I find that the wormwood, most of the herbs are broad-spectrum antimicrobial. Antibiotics address the bacteria. So if it's viral, if it's parasitic, they have no effect. However, a lot of herbs have been shown in studies, and most of the studies come out of England or China because they use herbs as part of their medical system. So wormwood, definitely. Olive leaf is broad spectrum. Garlic. So there's a number of broad spectrum antimicrobial herbs that really can address microbes of different varieties, not just the bacteria, not just the live.
This is a parasite
Yeah,
that
and
breaks
parasite.
open your red blood cells, so you have a severe clotting disorder. So all
I
of
know
these
someone-
address that particular parasite.
I do that. I add some other herbs that like support the blood, but I think it addresses it. But we don't have clinical studies for that with the herbs. What are they doing? I mean, they're giving flagyl type
Mepron is
the
liquid antibiotic made in India that does kill malaria and it kills syphilis. So using it in the human body, it doesn't even get absorbed unless you have fat in the stomach, because it attaches to a fat molecule to get into the bloodstream.
Yeah.
So it's very difficult to take, and it used to be $1,500 a bottle.
Yeah. I wish I knew. I mean,
Yeah.
it's a serious condition, and I always weigh, the benefits and the liabilities with Western medicines. So the herbs can help, but there's no guarantee that they would resolve the situation. So when I work with clients with this, we monitor and seek when we might need to work to limit the side effects from the drug. If that were the only thing that would work, we'd work to limit the side effects.
As you kill off the pathogens, and they leave behind debris, like in a lot of cases arthritic people,
Yes.
is there any herb that you know of that could remove that debris
Yes.
that's left behind?
Yes, I mean, that's what we were talking about. The detox herbs, the
Yeah.
chlorella. For me, I love cleavers, dalium, and red clover. These really help the lymph system work and eliminate. And they're often used also for joint and myopathies. There's pain in the muscles where the toxins build up. So I've had very good results with creating that. So thank you very much. It was great.